Hi everyone, my name is Andra Ragushila and it is my pleasure to welcome you to this interactive webinar titled Ask the Expert, Cannabis Edibles, Extracts, and Topicals. In today's session, we're going to hear from Dr. Robert Gabris from the Canadian Centre for Substance Use and Addiction. And our webinar will cover the prevalence of different modes of consuming cannabis, understanding the risk and benefits for different modes of consumption, and reviewing changes in cannabis use patterns during the COVID-19 pandemic. Before we get started, I'm going to run through a few items of our housekeeping. First of all, I would like to let everybody know we are recording the session. The recording will be posted on the Cannabis Knowledge Hub website, as well as our partners RNAO's website for future viewing. You can see the recording there about 1 week from today's session. The audio should be coming through your computer. If you have a hard time hearing me, you can also call in. You can write in the chat and we will give you instructions on how to do that. You can also ask questions throughout the session and we encourage you to do so. Please put your comments in the chat. You can turn on the chat from the lower right-hand side of your computer. I would also like to welcome our French participants who are listening through simultaneous translation. If you would like to be in the French webinar, this is the link. We can also share it in the chat pod for everyone. I would also like to acknowledge that CAMH is situated on lands that have been occupied by First Nations for millennia. These are lands rich in civilization with knowledge of medicine, architecture, technology, and extensive trade routes throughout the Americas. The site of CAMH appears in colonial records as the council grounds of the Mississaugas of the New Credit. Toronto is now home to a vast diversity of First Nations, Inuit, and Métis who enrich the city. CAMH is committed to reconciliation. We will honor the land through program places that reflect and respect its heritage. We will embrace the healing traditions of the ancestors and weave them into our caring practices. We will create new relationships and partnerships with First Nations, Inuit, and Métis, and share the land and protect it for future generations. As I continue to introduce the hosts, I would also like to know a little bit about the people who are joining us on the webinar today. You will see a series of interactive polls. Please let us know what best describes your work. Are you a service provider? Are you a system planner? Let us know where are you calling from. And lastly, what is the main concern when it comes to non-medical cannabis that you've seen in your practice during the COVID-19 pandemic? And we can also go through those at the end. This webinar is co-hosted by the Cannabis Knowledge Exchange Hub and the Registered Nurses Association. The Cannabis Knowledge Exchange Hub aims to create knowledge products, organize and host knowledge exchange events like this one. And we also maintain a curated and searchable repository of evidence-based resources. You can see those resources on our website, which is on the bottom of the slide here. Our main objectives are to facilitate alignment and cross-sectoral collaboration with service providers and other stakeholders. We hope to facilitate stakeholder access and use of evidence across the province and across the continuum of care. And lastly, through practice to policy communications, we hope to align system efforts at all levels of policy planning and practice. If you would like more information on the Registered Nurses Association Mental Health and Addiction Initiative, you can go to this website. You'll also find recordings of past webinars and other resources there. I will now like to welcome Dr. Robert Gabris. He is a research and policy analyst with the Canadian Centre for Substance Use and Addiction and has been studying health and social impacts of cannabis use and legalization in Canada for the last 2 years. He's the lead researcher on several cannabis projects, including the Clearing the Smoke on Cannabis series the Canadian Cannabis Research Database, and the Cannabis Public Education. More recently, he's developed several national surveys examining the impacts of COVID-19 on mental health and substance use in Canada. Prior to his time at CCSA, Robert completed a PhD and a postdoctoral fellowship in neuroscience, where he focused his research on the impact of stress on mental health, and he continues to pursue this line of research as an adjunct professor at Carleton University. Welcome, Robert.
Thank you, Andrea, for the lovely introduction. Can you hear me okay?
Yes, we can.
Okay, perfect. Thank you, everyone, for joining, for attending this webinar. I know that everyone is really busy, so I really appreciate it, and I hope that you find it interesting. I would also like to thank CAMH and RNAO for putting this together. It's a very important topic presently, especially with COVID, so it's good that, that we're doing this. So here's just a general overview of what I'm going to be presenting. In terms of most of what I'll be speaking to will be based on an evidence review that I believe we put together about a year ago now. It's part of a larger series called the Clearing the Smoke on Cannabis series. And this series is a set of evidence reviews that covers cannabis use in terms of various aspects of health, including mental health, cognitive functioning, respiratory and cardiovascular effects. And we're currently working on updating an evidence review on the medical use of cannabis and cannabinoids, so stay tuned for that. Before continuing, I just wanted to quickly mention that while cannabis extracts, edibles, and topicals have only recently been legalized since October 17th, 2019, a lot of these products have been used for quite a long time, including hash. So I'll be speaking to both products that are legally available and those that are technically illegally available. And I'll also be speaking to the fact that while these products have been around for quite some time, the evidence is relatively sparse. And that's something that I'm going to be referring to quite a bit. We don't have a lot of knowledge on how a lot of these products affect health, especially long-term use. So it's something that I will echo several times throughout the presentation. So sorry, I'm just figuring how to switch slides here. So I wanted to start quickly by describing a little bit about CCSA. So we were created by an act of parliament in 1998, to address substance use in Canada. And we serve several different roles in terms of substance use. So one of them is providing national leadership and drawing attention to important issues of substance use in Canada. Obviously, one of the main ones for us right now is COVID and substance use, so we're doing a lot of work in that area. Another role that we play is bringing various stakeholders together. So that includes researchers, healthcare providers, individuals with lived and living experience to tackle various aspects of substance use. We also conduct our own research on cannabis, alcohol, and other substances, and we also synthesize the evidence on substances in order to inform policy and practice. And last, but one of the more important tasks that we serve is knowledge mobilization. So through forums like this, we mobilize the knowledge that we collect in order to inform the public of various benefits and harms of substances. So here's a slide that lists various priorities that CCSA has within our mandate. Cannabis, of course, is one of them. and it's been one of our priorities now since, I believe, 2008. So we've been doing a lot of work in this area for quite a bit of time. One priority that is missing here is obviously COVID. So we've been doing a lot of work over the past almost a year now, a little bit, maybe 8 months, looking at how substance use has impacted, how COVID has impacted substance use in Canada, and how substance use in general might influence the course of COVID. So I'm not sure where, I know we have a pretty large crowd, which I'm guessing has a lot of varying experiences in cannabis. So I wanted to start off with a quick Cannabis 101, mainly by defining just some basic terms I'll be using later on within this talk. So cannabis is a greenish to brownish product of the cannabis sativa plant. So that's what most of us are familiar with. It is typically smoked, but it's also used to make a variety of other products, which I'll be discussing a little bit later on. Cannabis is made up of over 100 different chemicals known as cannabinoids, and the most popular one, the most well-known, is THC. So that's the one that produces the psychoactive effects, including impairment and intoxication, or the prototypical high that is known, that is associated with cannabis. And more recently, there's been a lot of interest in CBD, which does not produce the same high like THC, but it might have some sedative effects. And it's currently being researched for a variety of medical conditions, including certain rare forms of childhood epilepsy, as well as anxiety disorders and sleep. So in addition to the cannabinoids that are within the cannabis plant, the method of use plays an important role in when the effects of cannabis, or mainly THC, are felt, and for how long they last for. So this is an infographic that we had developed, I think, over a year ago now, and it illustrates the difference between smoking and vaping, so inhaling, and ingesting, which includes eating and drinking. So if I could draw your attention quickly to the left portion, the inhaling portion of this infographic. So when someone smokes or vapes a cannabis product, the THC is relatively quickly absorbed by the body and enters the bloodstream and into the brain. So the effects are felt relatively quickly, within a few seconds to minutes. The full effects are felt around 30 minutes after inhaling, and they typically last for about 6 hours. That does vary a little bit by person and how much they have consumed at the time. And some of the residual effects can last up to 24 hours. So that wouldn't necessarily be the high attributed to cannabis or THC. It would be more things like drowsiness or grogginess. If we look at the right side of the infographic, so ingesting, this is quite different. So typically, if someone eats or drinks a cannabis product, it takes roughly 30 minutes to 2 hours, sometimes even more, for the effects to be felt. And usually by 4 hours, that's when the full effects sort of kick in. And they can last up to 12 hours in some cases. So one thing that I did want to point out here is that this is extremely variable from person to person. And even within one person, if they were to consume an edible product one time, it wouldn't necessarily mean that the onset of effects or the full effects would be felt at the exact same time next time. So it is highly variable. Part of it is a person's metabolism. Another factor is also dependent on whether they have eaten anything, especially high-fat foods. That tends to speed up the process a little bit. Another important thing that I wanted to mention here is that there is some conversation about drinks being a little bit quicker in terms of onset. I personally haven't come across any of that kind of research yet. So for the purposes, at least, of this webinar, eating and drinking cannabis products typically take about the same amount of time for the effects to be felt, and for how long they last for. So I know that a lot of the attention over the past year has been on edible cannabis or cannabis edibles, but I would argue that cannabis extracts might actually be more important, and that's for several reasons. Partly because there's a lot more of them. There's a huge variety of these products, which not only differ in what they look like, what they smell like, and their THC and CBD concentrations, but they also vary in the way they are used. And I would also argue that the health and safety risks are probably greater with these products than with edible cannabis, especially if they are used inappropriately. And also, we pretty much don't know very much about these products in general, just because they haven't really been studied. So a lot of the research that has been conducted, at least in a lot of the surveys, has just been on dried cannabis. So for these products, we don't know very much about how they impact health or various aspects of functioning. Traditionally, cannabis extracts, the term refers to high THC products, such as shatter. So shatter is the amber-like glass, the yellow thing that's kind of in here. So it's those types of products, hashish, hash, wax, and generally cannabis extracts contain much higher levels of THC than dried cannabis. So for example, hash, shatter, keef, wax, they typically have THC concentrations of around 50 to 60%. Some of the vaping products that are available out in both the legal and legal market can have up to 95% THC concentrations. So to put that into perspective, dried herbal cannabis, currently the average amount of THC in one of those products is about 15 to 20%. And I have yet to see dried cannabis reach 30%. So we could see that cannabis extracts have considerably higher levels of THC than dried cannabis. And in addition to there being a variety of different kinds of cannabis extracts, they also differ in their method of use. So for example, if you look at the image here, the chocolate bar looking thing, so that's hash. That is typically smoked, vaped, either alone or mixed in with dried cannabis. Whereas something like shatter, so shatter again is the golden glass-like thing in the slide. That is typically dabbed. So dabbing is a specialized form of vaping where the person uses a very small amount, about the size of a pea, and inserts it into the specialized bong, and they take a quick inhale of that, and it's sort of similar to the idea of taking a shot of alcohol. So it's taking a very high potency extract and then inhaling it very quickly to feel the effects. In addition to these sort of extracts, there's also capsules which fall under this category as well. These typically don't have very high levels of THC. I think from what I've seen, they usually max out at around 10%. And then in the bottom right-hand corner, those are tinctures. So those are usually placed under the tongue, and they could vary as well in their THC levels, but normally they're, I think, around 30%. So, so in terms of these sort of products, they definitely vary not only in their appearance, but also in their method of use and in their THC and CBD concentration. So admittedly, we don't have a really good picture of the prevalence and use of a lot of these sort of products, just because they're fairly new. And the data that we do have available is actually from prior to their legalization. So this figure here is data from the Canadian Cannabis Survey that was collected April 4th, 2019 to June 17th, 2019. So that's prior to legalization. And we could still see that even when these products were still technically legal, a notable proportion of individuals were actually still using these products. In terms of who's specifically using them, it seems that they're more commonly used by males and by individuals who are under the age of 25. In terms of reasons for use, so this is again a little bit dependent on the product type, the method of use, and it is very individual, but generally people seem to prefer these products because they're considered less harmful to the lungs than smoking cannabis. Whether that's true for other domains of health is debatable, but that seems to be a common reason why people are currently using them. Another reason is that they don't produce any smoke. So unlike dried cannabis, which produces a very noticeable smell, vaping products and those that are ingested or placed under the tongue, they don't produce any sort of smell, so they could be pretty much used anywhere. And that sort of creates a little bit of a concern, because now whereas people who were using dried cannabis typically used it in a private residence or at home, vaping products or those that are ingested can be used really pretty much anywhere. And what that ends up happening is a person can become intoxicated or over-intoxicated in other places, which could put them at risk for various harms. And the final reason for using these particular products sort of depends on whether a person is using them for medical reasons or for non-medical reasons. It seems like, at least right now, high THC products are typically used more for recreational and non-medical reasons, whereas products with higher levels of CBD are used more for medical reasons. So in terms of the risks associated with these products, again, it's sort of hard to summarize them all together just because they are so different. But one common sort of statement that we can make is that they are proportional to the levels of THC in the product. Generally, higher THC products carry with them higher risks, and that includes over-intoxication, which can involve anxiety, vomiting, and paranoia. And there's also research showing that using high THC products regularly is associated with a greater risk of dependence and addiction to these products. In terms of their long-term health effects, we simply don't really know, and that's partly because the measurement of cannabis in a lot of previous research has not been very specific. It's been pretty limited. As an example, a lot of these surveys would only measure cannabis as a general term and only look at frequency. So we don't have a lot of data looking at specific extracts, whether they're vaping, whether there's some of the more solid concentrates like shatter or wax. We just don't really have a lot of data there. That being said, though, there is some research coming out showing that high THC products, so even including high THC dried cannabis, is associated with a greater risk of mental health concerns relative to products that have lower THC. So for cannabis edibles, so they're essentially any food or beverage product that contains the cannabis extract within them. So that really could be anything. It could be chocolate, brownies, cookies, candies, soft drinks, etc. Just like cannabis extracts, they do vary quite a bit in their THC and CBD amounts. In Canada, for example, the legal limit is 10 milligrams of THC per package, and that could mean various things. So it could be one piece of chocolate within a package that has 10 milligrams of THC, or it could mean 4 pieces of chocolate that contain 2.5 milligrams of THC per package. On the illicit market, on the other hand, THC levels are considerably higher. They could go up to over 100 milligrams of THC, and they are not very well packaged. So they definitely carry a higher risk associated with them. Another important difference between the legal and the illegal market is that the legal market is still a little bit behind the illegal market in terms of diversity. So on the illegal market, you could pretty much find anything that contains THC in it, and that can be an edible. So for example, the picture here of the gummies, so this is something that wouldn't be legal on the legal market just because it looks appealing to children. So that is one restriction that has limited a little bit the diversity of products within the legal market, but it is a growing market even within the legal market. And one item in particular that seems to be growing are drinks, so mainly soft drinks. I've been seeing a lot of those online and in stores, and they seem to be becoming increasingly popular, especially among females. Again, sort of what I said with the data on cannabis extracts, we don't really know. We don't have a full picture of who is using these products and how frequently, but we do have some data. So again, from the Canadian Cannabis Survey, which collected their data prior to legalization, we could see that among individuals who do use cannabis, around 10% of them have reported using an edible at some point in time. And one interesting finding here actually is that edibles seem to be more commonly used, perhaps more preferred by females. And some research indicates that this might be partly related to the fact that females would like to avoid the stereotype of a cannabis user. So they typically stay away from products that are smokable or vapable. Beverages, on the other hand, seem to be pretty uncommon, at least prior to legalization. I imagine these statistics are going to be changing a little bit over time, especially as these products are becoming increasingly available. In terms of reasons for use, so the reasons are much the same as the cannabis extracts, especially the ones that are being vaped. They're technically considered, or they're perceived to be more or less harmful than smoking, especially on the lungs for obvious reasons. They are much more convenient and discreet. There's no smell, there's no smoke, there's no vape. So again, they could be consumed really anywhere. And a lot of people seem to like the fact that the effect lasts a lot longer in comparison to products that are inhaled. In terms of health and safety risks, the big one here is certainly over-intoxication. What often happens is because of the long delay in the onset of effects, some individuals take a little bit and grow impatient and then end up taking a little bit more. And then they end up just dosing a little bit too high, and then that leads to over-intoxication. Another reason for over-intoxication is also that some people just don't know how much to take in the first place. So as I mentioned in a previous slide, while the legal limit is 10 milligrams of THC per edible, on the illicit market, it could go up to 100, which is extremely high. So if a person eats half a cookie of 100 milligrams, they could easily reach a state of over-intoxication. Another public safety risk associated with edibles is impaired driving. So because the effects last for very long, in some cases 12 hours, and some of the residual effects can last up to 12 hours, or up to 24 hours, this does pose a risk of driving while still impaired by cannabis. And one that's received a lot of attention, especially in the United States, has been unintentional ingestion, especially by children. So there have been a number of cases in Colorado in particular where the prevalence of intoxication by children went up following legalization, and that was mainly due to poor packaging. So those weren't necessarily, I believe, in child-resistant packages, and public education around safe storage wasn't great at the time. So Colorado has made significant improvements there. Health Canada has applied strict regulations around labeling, packaging, and there's been a lot of public education around safe storage of these products. Whether this sort of has changed since its legalization, I am not really sure. I know that some hospitals in BC, for example, did report increased cases of intoxication by children after legalization. But a lot of those cases seem to have been mostly in teens, so kids over 16 to 17-year-olds, and not as many of them were in the 6 to 7 year range. So cannabis topicals, they're a pretty easy topic to cover, mainly because we just really don't know anything about them. They weren't really popular prior to legalization, and they don't seem to be, at least currently, very commonly used. So I should mention these products include any type of oil creams that are intended to be either placed on the skin, hair, or nails. Data from the Canadian Cannabis Survey prior to legalization indicated that these products were slightly more commonly used by women than men, but there is an increasing proportion of men that are using these products, mainly for joint and muscle pain, and that's partly because CBD presumably does have some anti-inflammatory and antioxidant properties. So the cannabis industry is exploring, and there is some research exploring whether these types of products might be useful for topical pain or inflammation. Generally, because these products are mostly CBD based and don't contain much THC, the likelihood of producing psychoactive effects is pretty low. But we don't know. There hasn't really been research looking at whether a topical cream that is high in THC is applied to the surface of the skin or even on open skin, whether it's possible to produce any psychoactive effects. So at least we don't know. We do know that through several case reports that Some of these topical creams, well, mainly the ones on the illegal market, can produce allergic reactions, including itchiness, swelling, and hives. So in terms of COVID-19 and cannabis, we do have a pretty good sense of, of how cannabis use in general has changed since the onset of COVID, but we don't really have much data looking at specific product types. So we did collect some data back in late April, looking at whether COVID-19 was associated with an increased use in several different types of products, and these are illustrated here within the figure. So among individuals who use each of these types of products, it seems that the extracts have gone up the most relative to other products. So we could see here the solid extracts, including shadow wax and butter. For those products, 25% of individuals who use them reported using them more frequently. Whereas looking at that relative to dried cannabis, those extracts are a little bit more commonly used during COVID. And that sort of wraps up for most of my talk. I did want to draw some attention to a variety of public education resources that we have been developing. So some of these include information on how cannabis interacts with prescription medication, with other medications. And we also have put together various resources on the link between COVID-19 and cannabis smoking, and some public education messaging around that. So I think that's it for my presentation. I think we're on to the Q&A now.
That's right. Thank you so much, Robert, for a really great overview of the different products that are available, different ways they're being used, different risks. I think everybody's learned a lot. I have quite a few questions submitted. I also would like to encourage participants in both the English and the French webinar to submit their questions through the chat pod. Again, you can turn that on and off from the lower hand side of your screen. And in terms of the questions that have been submitted so far, first is the actual and new diversity in cannabis products, edibles, and extracts concerning to you? What will be the best approach or public policy considering the necessity to find a balance between reducing harm but also eliminating the illicit market?
That's an excellent question. I think having a greater diversity of products within the legal market is actually an important step in reducing the illicit market. So making the more products that consumers have available to them legally, the more likely they will refrain from going to the illicit market. And I think adding here, something that I did mention earlier is one of the main distinctions between the legal and illegal market is that on the illegal market, the products are carefully regulated. They're inspected for not only THC and CBD levels, but also for contaminants. On the illicit market, like you don't necessarily know what you're getting. And I think that's an important message to a lot of individuals who might be interested in cannabis, regardless of the product that they're interested in. So to sort of come back to the question, I think having a larger diversity of products on the legal market is actually beneficial in reducing the illicit market.
Thank you. Yes, and the legal market also allows control of THC levels. So our next questions are kind of tying into that. What are the highest levels of THC that you've seen in dry cannabis, and what are the highest levels in concentrates?
In dried cannabis, I believe, on the legal market?
The question didn't specify, so it would be interesting to see both legal and illicit.
Okay. On the legal market, I think the highest we've seen was perhaps around 26 or 27%. On the illicit market, I have no idea, because someone could just tell you it's 40% THC, and you don't really know unless it's been really tested. For concentrates, the highest I've seen were in vape cartridges, and that was 95% THC. So it's quite a lot.
Yeah. And the question goes on to ask, what are the normal ranges for THC for the average person to consume, and what would be considered high THC?
That's an excellent question, and I truthfully don't really have an answer for that, just because it really varies from one individual to another, and that's partly genetic. So some individuals are very sensitive to THC, whereas others could consume quite a bit and be okay. So there currently isn't any sort of a standard for what is considered high, medium, or low THC for a person. And that's why we always recommend to start low and go slow. So normally for someone who is just getting into cannabis, we suggest starting with 10% THC or less, with equal or more amounts of CBD. So that's for the inhalable products. For edible cannabis products, it is suggested to start with 2.5 milligrams of THC with equal or more CBD, and then sort of work your way from there. But yeah, the general message is to start low, go slow, and then figure out where your desired levels of cannabinoids is for you.
Thank you. We're also getting a few questions, and I think you've almost answered the next one too, in terms of quantity measures for cannabis extracts and edibles, similar to we would have for like standard drink measures. So you've just kind of said the level of THC where people should start. Is that what you would consider like a kind of standard measure, or do you have anything further to add in terms of what those standards could be?
My answer to that would be the research community is working really hard to identify a standard dose or standard drink version for cannabis. We're not quite there yet. Part of the issue is because there are so many different types of products. Some are ingested, some are inhaled, some of them you drink, you put under your tongue. It's hard to come up with an equivalent, it's called equivalency factor, across all of them. So research is still across the world trying to figure out how to appropriately calculate that number and what a standard dose should be for cannabis. So we're not quite there yet, but we do recognize that is one of the most important next steps in cannabis research, especially in producing a lot of harm reduction messaging, because it is pretty difficult to read some of these labels and figure out what they mean and to apply it to yourself.
Thank you. And now switching gears a little bit, thinking about intoxication. What is usually considered intoxication? Is it determined by blood levels or clinical presentation?
That's a good question. It's typically, I'm assuming this is more of a question within the impaired driving context. So there are tests that have been developed, and there are certain police officers that have been trained in drug recognition, including cannabis. So there are certain behavioral measures that can measure intoxication by cannabis. In terms of THC levels are also used as a supplement measure of intoxication, but they are not necessarily perfectly reflective of that like alcohol would be. So that is another area of my research right now is trying to measure impairment from cannabis using various behavioral measures.
Thank you. Switching tracks again to the link between COVID and cannabis, and you touched a little bit about this in your last few slides, and I know you also have some national surveys that are looking at that. So what is the link between COVID and cannabis? Does it have to, with people not having to worry about work, not having anything to do? I think people are looking at if there's any research on the reasons why there might be a correlation, and has there been an increase in purchasing from the legal or illicit markets? Have we seen a switch there, perhaps?
To answer the first part of that question, the increase in cannabis use has generally been associated with actually three factors, and they kind of overlap with alcohol as well. So it's in the initial stages of COVID, a lot of it was a lack of regular schedule. So people being from home more, trying to figure out how to navigate the whole new experience of being in a different routine. So lack of routine was one of the main factors. Stress, of course, was another big factor, and boredom was the third. In addition to that, there have been several surveys showing that cannabis use has increased, especially among individuals with depression and anxiety. Whether that's reflective of a coping mechanism, we don't know, but we know that individuals living with those conditions have increased their cannabis use as well as alcohol relative to individuals who are not experiencing those conditions.
And then the second part of that question was asking about if you have any information increases or if there's a difference level of change following the pandemic in the legal or illicit market.
I'm not sure. I think I am not aware of any data on that topic in particular. I know that sales of cannabis have increased, the legal sales of cannabis have increased during early stages of the pandemic. I'm not sure if there's data available on that or more currently, but in April, March, April, and May, it definitely did increase, but whether that's continued, I'm not sure. The illicit market, whether there's been a transition to that, I don't know, because cannabis stores didn't close down in most of Canada, so I don't imagine that they would have transitioned there. And I think that was part of the reason why at least I'm in Ontario, I'm in Ottawa, so I know that part of the reason why cannabis stores remained open was to make sure that individuals weren't transitioning to the illicit market.
Thank you. And I guess just to clarify, when you're speaking about changes in purchasing, does CCSA have access to collect data from commercial vendors to track those trends, or are those self-reported by consumers?
We don't have access to that data. I know that certain cannabis retailers do post their sales records publicly. And I imagine that, don't quote me on this, but I think Statistics Canada does have some data on cannabis sales on their website. but I'm not sure where that is necessarily from, but I do know they do have some data on there. So that's on their website.
Thank you. We also have a couple questions around cannabis and older adults. And I would also like to make a quick reference for anybody who has questions on this topic that we co-hosted a webinar again with RNAO on the topic of older adults and cannabis smoking and, cannabis consumption. And you can find that on the Cannabis Knowledge Exchange Hub website. If you go and you sort by older adults and webinars, you're going to see it right there. Just in case people have like really kind of in-depth questions on that. But I also wanted to ask you, what is the research about cannabis use in older adults? The question is coming from somebody who works in a long-term care home and is wondering if it's been studied in relation to treating pain or mood.
That's admittedly a population that has been overlooked quite a bit within the cannabis research. I know there's a lot of work going on right now looking at how various forms of cannabis and reasons for use, so whether it's for medical reasons and not medical reasons, how that impacts older individuals. I think it is pretty limited in terms of pain. There is research supporting a role of cannabinoids for pain, whether it's more effective than certain other drugs, I think is a little bit questionable. Yeah, I think that's kind of the most I could say there. There's definitely a lot of interest in using cannabis for various conditions, including pain, and there is some evidence to support its effectiveness in neuropathic pain. But that is something that needs to be carefully discussed with the person's practitioner, healthcare practitioner, to see whether the risks or whether the benefits outweigh the risks. So that's definitely something that should be consulted with and followed up by a physician before choosing to use cannabis for those purposes. And I think another point that I do want to mention, especially within medical cannabis sort of work, pardon me, a lot of the research that has been conducted thus far on the use of cannabis and cannabinoids for various aspects of health has used oral extracts or synthetic versions of THC, which are very low doses of THC. I think some of them are around 2.5 milligrams of THC, and that's mostly what's used in clinical trials. There have been very few studies looking at smoked dry cannabis for any of these conditions. So I think that's an important aspect to remember, especially when reading some of the media out there or watching it. It's a lot of the research being conducted isn't actually currently on dried cannabis. It's on formulations or extracts based on that, and they're pharmaceutical grade drugs.
Thank you. And then for THC, there's a part two to the question around seniors for whom falls can be an issue. So are falls or the risk of fall, is that related to THC concentration in any way, or is there no correlation between the two?
So cannabis THC certainly has effects on motor or movement and coordination, and that's why it does impair certain aspects of driving. And for that reason, THC can increase the risk of falls among older individuals. And while there isn't necessarily research on this, I would argue that the more THC someone consumes, the higher risk of accidental falls you would experience.
Thank you. We have four quick questions for the last 4 minutes or so. In your opinion, what are the effects of or side effects on the lungs from vaping products?
So I'll speak to the evidence, and I could say that we don't really know. We do know that the chemicals within the vaping oils can be an irritant to the lung tissue, but we don't know what the effects of long-term use of these products is on the lungs right now.
Thank you. We also have a question around how do edibles interact with other medications compared to smoked cannabis. So let me know if you're prepared to speak to that. We also did a webinar earlier this year with Dr. Maria Zand. Again, it's on our website. You can search for it under the webinars menu, looking specifically at pharmaco-interactions for both edibles and smoked cannabis. But do you know of any difference in interaction between the mode of consumption?
I'm not specifically sure on this topic. I don't know whether mode of consumption really makes a difference. I think we do know that cannabinoids do interact with drugs that affect the central nervous system, so especially depressants. And that is one of the main interactions. So anything that slows down the central nervous system or the brain should be avoided, or cannabis should be avoided if someone is taking medications for those reasons. And that could include some anti-anxiety drugs, some sleeping medication, and some cold and flu medications that do have the central nervous system depressants can also interact. Whether they're major interactions, I would argue that most of them are not. Perhaps the only one that would be are some of the sleeping meds that would be a more significant interacting factor.
Thank you. And then we have a clarification. Sometimes participants reported hearing rumors of illicit dried cannabis being laced with other products such as fentanyl or other substances. Is this possible, and have those been confirmed?
It is possible. I'm not sure if it's happening currently right now. I haven't really seen any data monitoring that as much. So I'm not sure. I'm not sure if it is something that is really out there anywhere in any of the provinces currently.
Thank you. Are you aware of any research on the effects of cannabis use on fertility for men or women?
This is a pretty limited area of research, and I'm not very familiar with it, so I can't really speak to it. I know there was some earlier research showing that regular cannabis use among men reduced sperm count. Whether that has been replicated more recently, I'm not sure.
Thank you. And last question. For legal products, the concentration of THC and CBD is indicated on the label of the legal oil sprays. However, it isn't clear how many mils are given in one dose, so one spray. Is there any clarification you can give on that?
I haven't actually seen one of those products in person, so I'm not sure if it's already been implemented, but some of them have like little lines on it to show you how much like a milliliter would be per dose. And I know some companies were working on on mechanisms for a lot of those little things to make sure you're only administering a certain dose. But I'm not sure if that's something that's already currently on the market.
Thank you.
But it's an excellent question because the package clearly states how much is in the entire bottle, but it can be difficult to figure out how much you're administering in one shot with some of those instruments.
Yes, I think standard measures are really the next big questions that everybody's going to try to develop. So thank you so much, Robert, for today's session. An amazing presentation, and thank you for sticking around for the Q&A and answering everyone's questions so quickly. I would like to ask all the participants, if you've enjoyed today's presentation, to complete the evaluation. We're going to pop the link in the chat pod. It helps us with planning, and also it helps us to know if we were successful in achieving today's objectives. I would also like to thank Tanya Costa from RNAO as our co-host, as well as Rosanna Coriandoli, Sarah Calvin, Mel Brooks, and Danielle LaRoche for helping us put our webinars together. And you can visit our website at camh.ca/Cannabis Knowledge Hub, or our partners' website at RNAO BPG Initiatives, Mental Health and Addictions for any upcoming sessions. Thank you very much and have a great day, everyone.